Today, we embark on a journey to unravel the intricacies of dengue fever, a mosquito-borne illness that has etched its presence globally. From its historical roots to the current challenges it presents, we will explore the disease's various facets. So, let's delve into dengue fever, examining its history, the biological characteristics of the virus, transmission dynamics, disease progression, and the ongoing efforts in medical treatments and prevention. The most common cause of mosquito-borne viral infections in the world. The first plausible outbreaks of dengue fever occurred in Southeast Asia, Africa, and North America in the 18th century. Even though the first possible outbreaks date back to the 1700s, the oldest description of a dengue-like illness dates much further back to the Qin dynasty in 265 AD. They described a water poison that was connected with flying insects. The first known epidemic of dengue fever occurred in the Philippines in the 1950s, marking the beginning of dengue's rapid spread to tropical and subtropical regions worldwide. The dengue virus, a member of the Flaviviridae family, stands as the culprit behind this debilitating disease. Comprising 4 distinct serotypes, DEN1, DEN2, DEN3, and DEN4, the virus is primarily transmitted by Aedes mosquitoes, notably Aedes aegypti and Aedes albopictus. Understanding how dengue spreads is crucial. Aedes mosquitoes play a pivotal role in transmitting the virus through their bites. They become infected when they bite a person who is infected with the virus. Once infected, mosquitoes can continue to spread the virus throughout their lifetime. These mosquitoes also spread the Zika and chikungunya viruses. Less common, but also possible, a pregnant woman that already has dengue fever can pass the virus to her fetus during pregnancy or around the time of birth. Additionally, there has been one documented report of the disease being spread by breastfeeding. Even though most people that get dengue fever won't have any symptoms, the symptoms can start as early as a few hours or as late as 2 weeks. As dengue fever unfolds within the human body, the incubation period lasts between 4 to 10 days post-mosquito bite. About 1 in 4 people infected with dengue will get sick. The people that are infected can have mild or severe symptoms. The most common symptoms of the fever are nausea, vomiting, rash, aches, pains. An even smaller number of people have severe symptoms of dengue fever, about 1 in 20. In severe cases, a person will have belly pain, tenderness, vomiting, bleeding from the nose or gums, vomiting blood in the stool. If you've had dengue in the past, you are immune to that version of the dengue, but you are more likely to develop a severe version of one of the other 3 versions of dengue in the future. Let's put the numbers into perspective. Globally, nearly half of the world's population live in areas with a risk of dengue. That means about 4 billion people are at risk of developing dengue fever at any time. Furthermore, dengue is the leading cause of illness in these locations. Each year, up to 400 million people get infected with dengue. Of that number, approximately 100 million people get sick from infection, and 40,000 die from severe dengue each year. Because there are 4 different versions of this disease, a person can become infected by a dengue virus up to 4 times in their lifetime. Dengue fever's impact is profound, with high incidence and prevalence rates. Mortality rates and morbidity trends underline the severity of the disease, particularly in developing countries and among vulnerable populations. Dengue's transmission is not merely a biological process but is also influenced by environmental factors. Stagnant water serves as a breeding ground for Aedes mosquitoes, contributing to the ease of transmission. Rapid urbanization exacerbates this by providing ideal habitats for these vectors. Preventing dengue requires a multifaceted approach. The simplest way to prevent dengue is to keep yourself from being bitten by mosquitoes. You can do this by using EPA-registered insect repellent, wearing permethrin-treated clothing, install screens on windows and doors, and using air conditioning if available to keep from having windows and doors open. Also, you can prevent mosquitoes from laying eggs near you by decreasing the amount of standing or stagnant water around your house. That means dumping buckets after use or removing items that can hold water. Lastly, you should consult the CDC travel guide when traveling to help protect yourself. Public awareness campaigns and community engagement are pivotal in minimizing the disease's impact. Currently, supportive care stands as the mainstay of dengue treatment, with a focus on fluid replacement therapy to prevent dehydration, especially in severe cases, strong pain relievers such as paracetamol or acetaminophen, oral rehydration salt, and blood transfusion in severe cases involving blood in the vomit and stool. While there is no specific antiviral treatment available, there is a vaccine that is available with stipulations. It is only for children and adolescents at the age of 9 to 16 years old who have been laboratory confirmed to have had dengue virus previously. In conclusion, dengue fever requires our collective attention. By unraveling its history, understanding its transmission dynamics, and exploring treatment options, we can work collaboratively to minimize its future impact.